My name is Olaniyonu Sokabi, and I will be doing my public health presentation on tobacco addiction. For in some background information, although there has been a decrease in smoking rates since the 1960s, smoking is still one of the leading causes of death both worldwide and in the US. And by 2030, there will be about 10 million deaths annually of people who use tobacco products. And from those 10 million deaths, there will be 7 million of uh, that happen in developing countries. There will also be a loss of $82 billion in lost production, as well as another $75 billion due to medical spending. And in lost production, it's because people are being less productive by spending their time smoking. And for medical spending, people who have developed health issues due to tobacco products will need to be treated. So, in the current situation, about 8 million people are killed each year due to tobacco, and 7 of those 8 million people are due to the direct use of tobacco, while the other 1 million is from exposure of secondhand smoke. So, that's being exposed to smoke around people who are smoking. And then most tobacco users are from low to middle income families. So, these are families who probably go through a lot, and smoking is kind of used as a coping mechanism. So for my SWOT analysis, my strength is that taxes were put on tobacco products. So in 2009, the FDA was granted authority to regulate the sales, marketing, and manufacture of all tobacco products in the US. A weakness is despite efforts to get people to quit smoking or using tobacco products, there are still those who don't quit. Opportunities are increased programs geared toward the youth to prevent early smoking. So those are programs like the Truth Campaign that advertises both on social media as well as on television to children about the effects of using tobacco products. Threats are that tobacco companies enlist the help of powerful legislators to help them win cases in selling tobacco. So these companies are funding legislator campaigns, and in return, legislators are there to help defend them when they are being sued. For prioritizing core issues, due to the abundant amount of toxins in cigarettes, people who smoke them are exposed to an incredible amount of health effects. So these health issues could include cancer, heart disease, COPD, and diabetes. This picture on the right shows some health risks that occur from smoking. So for my alternatives, I decided to use a social ecological model, and this has to deal with the individual, the relationship, community, and society. So for my first approach, the individual will need to realize that they have an addiction and need to look for steps in order to combat it. So this could be speaking to a doctor or a specialist who can introduce them to programs so that they can figure out what the underlying issue is and how to kick their habit. My second approach is that enforcing even more strict policies on where people can smoke. I feel since UCI is a smoke-free campus, I think that is a great example in how we can combat tobacco products being on our campus, as well as health effects that other people who even don't smoke can get from the secondhand smoke. For my third approach, regulating the production of supposed alternative tobacco products, so that could be Juul pods or any other tobacco products that could cause very deadly health effects and health issues. For my recommendation, I say that we should limit the advertising and exposure of cigarettes in gas stations and other large chain stores. There are a lot of advertisements for cigarettes outside of gas stations, and I feel like if we regulate that, I feel like people would be less compelled to go and buy them because they're not being advertised there all the time. I also said that government funded programs aimed at helping habitual smokers could help, as well as increasing the taxes or prices higher than they already are of cigarettes. For my action plan, I believe that those who buy tobacco products should be required at checkout to sign an agreement understanding how tobacco products can have health effects on them. And I understand that some tobacco products have health label warnings, but not all consumers read them. So being either verbally told the health effects while they're purchasing it or having to sign something will help them realize how dangerous it is to take these products. Also, I believe physicians should assist in introducing those with a tobacco addiction to addiction programs and help them find alternatives. For my 5 year plan, for 1 year, I say that we should ban all advertisements of tobacco products at major gas stations and grocery stores. The other year, create federally funded programs that help tackle tobacco addiction, similar to the Affordable Care Act, that uh, allowed people to get free tobacco addiction treatment and counseling, as well as medication. And then for the next 2 years, we create education curriculum targeted at teaching kids from a young age the effects of tobacco addiction. In my opinion, I believe that there are many factors like socioeconomic status and stress that cause people to take tobacco products, but continued efforts such as anti tobacco and smoking campaigns, tax regulations, and addiction support lines could help increase the occurrence of the issues, as well as speaking to younger generations about how tobacco products are dangerous. So that's my presentation, and thank you.